And this is a more difficult medical topic to address, one that has to be talked about, though. According to the World Health Organization, suicide is the third leading cause of death in teenagers. So as we mark Mental Health Awareness Month, I want to bring in Dr. Nicholas Westers, who is a pediatric psychiatrist at Children's Health, to help us talk about mental health and our kids. And I do appreciate you being here. As the father of a 11-year-old, a 9-year-old, and a 6-year-old, I feel like there is never too soon of a time to start talking about mental health with our kids.
Absolutely. I have a 4-year-old myself, and I know you just cited the World Health Organization saying suicide is the third leading cause of death among adolescents. Here in the United States, it's currently the second. So I think this really emphasizes the importance of talking about not just mental health, but suicide, which can occur outside of the context of a mental health diagnosis.
I do know that when it comes to things like anxiety and depression, we are seeing higher incidence rates in teenagers. Is this a situation where there's more awareness, so more reporting, or do you think you're seeing more occurrences?
I want to say a little bit of both, particularly because of the pandemic. I've noticed, at least in my practice at Children's Health, when I see adolescents, I've seen a lot more anxiety. And we know from data that we were tracking during the pandemic that there were more anxiety symptoms, not necessarily anxiety disorders, but with symptoms going up, disorders likely go up as well.
Are we at a crisis level when it comes to these issues?
I don't like to use strong language like crisis in a whole lot. I think it's a concerning level that can be addressed, and I think we are doing a lot. I know there are a lot of mental health professionals that are doing a lot of work. A lot of parents are being more attuned to their children and their needs, and I think we're seeing a lot of that.
I don't think you can have this conversation without talking about the impact of social media and technology. Anybody who has seen our digital parenting series here on WFAA knows that it's a topic we talk about a lot. If you watch the movie or the series Adolescence on Netflix, you saw the correlation that they kind of showcased about the use of social media, especially, and just what it does to developing brains. How much of a factor do you think that is? I know it's hard to establish causality, but it's hard not to think that there's some connection there.
Yeah, I definitely would not say social media causes these problems, but it can contribute to a lot of them. And I don't want to worry people too much about these things, but I also don't want to downplay it. So when I think about you referencing the Netflix special Adolescence, I think one concern that I have is when adolescents in particular go to these corners of the internet that starts to normalize certain behaviors or beliefs, makes it seem like a lot of people share them when they don't, then that's when we'll see some more concerning behaviors as a result. However, a lot of people, a lot of adolescents use social media to connect with others, and if they are struggling with mental health, they might test the waters by posting about it anonymously to friends or to followers, and then see how they respond before they decide to share with their parents or a teacher or a trusted adult, just to see how they would respond, because of mental health stigma still exists.
I think that's the hard thing about the online world. Is in the physical world at school, you have these kind of baby steps. In the online world, it is this open door rush of everything all at once that just kids' brains struggle with. And maybe you're mom and dad and you're sitting at home and you see some potential warning signs. What do you think parents need to look out for? And if you see something, what do you do?
So a couple things. When we're talking about anxiety and depression oftentimes in children and adolescents can manifest through irritability. So a parent might not think that their child is depressed, but they're really defiant and they're angry all the time. And so the parent will increase the consequences. Well, you got to talk to me respectfully. Well, you can't punish your way out of a depressive episode for a child or adolescent. And we think about children with anxiety, they might refuse to go to school. And again, it can manifest through irritability, and then parents can be like, well, they're refusing, it's a behavioral problem, when in reality, they're really anxious. So when I think about anxiety in particular, parents can be attentive versus accommodating. We don't want to necessarily accommodate anxiety, which is really tempting to do, because as parents, we don't like to see our kids in distress.
Right.
I know you have a few children of your own, you don't like to see. However, sometimes that's what they need to be able to grow. I think about the butterfly escaping the cocoon. It needs to be able to get out on its own to strengthen its wings to be able to fly. If we help it out, it's not going to be able to fly.
That analogy holds up on so many levels. Dr. Westers, I wish we could talk all day long, because this is such an important topic, but I appreciate you joining us today to help shed a light on these mental health issues that I know a lot of parents are leaning forward and listening to today.
Thank you for having me.
Yeah.